Hello, everyone. I'm Kevin Kunzman, Managing Editor of Contagion, joined for another video conference interview as part of our ongoing COVID-19 coverage. And today we're talking about one of the most early and frequently stressed topics that's continuing to evolve in understanding and response in the scope of the pandemic, and that is pregnancy risk related to coronavirus. And today I'm joined by Dr. Mary Jane Minkin. Dr. Minkin is an obstetrician gynecologist and clinical professor at Yale University, and we're going to be discussing some new CDC data that came out just about a week ago now, I believe,
About right.
Pregnancy risks related to COVID and vice versa. First and foremost, Dr. Minkin, how you doing?
I'm doing fine, thank goodness, and I trust you are too, Kevin.
I am, and thank goodness for that. Yeah, certainly. And so maybe if we could just start by looking at the bare bones of these findings published by the CDC, looking into the prevalence of COVID cases in pregnant women versus non-pregnant women and severity of it. What did we learn from this, Dr. Minkin?
Well, this is the whole question of COVID and pregnancy is in a state of flux, as is much of the COVID information. I mean, fortunately or unfortunately, it's a relatively brand new disease about which we don't have a ton of information. And of course, pregnancy is a state which is anxiety provoking to most women going through with it and their partners and families and things like that. And of course, COVID is an anxiety producing state. So you put the two together, we get a magnification of the concerns. And of course, with this being a relatively new entity for us to be studying, every bit of data that has come out has been, latched onto by many people, like, oh, we know this, but there's mostly stuff that we really don't know. And the one good thing that when we started seeing the COVID pandemic was that pregnancy did not seem to be a tremendous variable in the course of the disease. In other words, it looked like women who were pregnant didn't do particularly better or worse because they were pregnant. I mean, other than the course of the disease in anybody, in this age range. The other thing that we saw initially, fortunately, was that the fetus in utero did not seem to be adversely affected by this emerging pathogen, and contrast that with our recent experience with, say, Zika, which certainly didn't do terrible things to the mom, but unfortunately did terrible things to the baby in utero. So that at least the original presentation was, well, this is, it's not a good disease by any means, but it certainly doesn't seem to have extra adverse effects on the pregnant woman or fetus. And that was the assumption that we were going through for the initial few months of this disease. And if you look at one thing that I can always encourage all of viewers to do, and I'm sure you do on a regular basis, is encourage people to go to the cdc.gov website, because there's lots of information there that's constantly being updated. Also, the American College of Obstetricians and Gynecologists, ACOG.org, has lots of information there for both physicians and for patients. So, to get the latest information as it is ever changing, please go to one of those two websites to get you the truly up-to-the-minute data. But what happened last week was that we had the first emergence of data coming out saying, maybe it is worse for pregnant women. Maybe this is not, as we had hoped, just, a terrible disease, but nothing that had a better or worse impact on pregnant women. So that was the concern that was voiced last week. And I hope that summarizes where we were and where we are at the moment.
Yeah, it certainly does. And thank you for that. And thank you for the reiteration of those excellent resources to stay and tapped into. Again, this is, as good as an academic journal and, of course, public health resources you're going to find in the world right now. And certainly looking at these findings, I mean, unfortunately, they kind of read very logically, which is unfortunate. It answered a lot of the concerns that were had initially in terms of greater risk of eventual ICU for pregnant women. And as you mentioned, the greater risk of stress and anxiety and overall pregnancy health has to be a major concern in relation to these findings. Dr. Minkin, can you talk a little bit more about, the risk, the compromises that could occur in an infected pregnant woman?
Sure. Well, what the latest interpretation of data that we have, I guess that's probably the best way to phrase what the CDC talked about last week, is that there was no increase in mortality, fortunately, in pregnant women. That's good. I mean, let's say that right out. However, the morbidity seemed to be, the women seemed to get sicker if they were hospitalized. So those women who had to get hospitalized for COVID seemed to have somewhat of a rockier course than women who were not pregnant. And of course, part of this, and again, none of these are prospective randomized double-blind controlled trials, which is of course our gold standard for talking about, data of any medical scientific nature. And of course, one of the concerns I have in interpreting this is, were people just more cautious because the woman is pregnant, to say, gee, these are women who are pregnant, maybe they do have some degree of respiratory compromise. I mean, one thing to remember is when you got a big kid in your belly, your diaphragms are pushed up. And that's just a fact of life. And indeed, is that what causes pregnant women maybe to have some more respiratory issues, in any sort of a pulmonary condition? So are they being more cautious? Do they put these women in the ICUs quicker than they would have had they not been pregnant? Things like that. So there are some obviously observational or procedural issues involved with watching the women. But I just think the overall statement there was, maybe we have to be a bit more cautious with women, in pregnancy as far as when they present with COVID. So that would be my interpretation. Now, the other thing because obviously I've had many calls from patients about this, like, what are we supposed to do? And I think the thing to do is to reassure people that this is yet another statement and the CDC is a great outfit, don't get me wrong, but that, by next week, things may change. And we may, as we've discovered in this epidemic or pandemic so far, is that we'll get a report one week and then a week later it'll be, no. I mean, for example, one of the questions, does COVID get across to the fetus? Well, there came a report, no, it doesn't get across to the fetus. Well, then there came a report, oh yeah, but we've recovered COVID viruses from the placentas of several women. Next week, in the rebuttals to that statement, yes, but the placentas came through the vagina, and we know you can get transvaginal passage to the placenta, so it doesn't prove anything. And these things have been going back and forth, since the beginning weeks of the pandemic. So I'm telling everybody, don't assume every bit of data that we get is the gospel, and stay tuned and see what develops, and just adopt a cautious attitude, which we should do with everybody.